So, I mean, I literally have to give myself this. I am a clown. Literally, clown, serious clown from Ekiti and Ogun State. Anyway, today on this new episode of the Let's Talk Public Health Show, we have in our studio the founder, co-founder, CEO, right? Mm-hmm. You're the co-founder and the CEO of Famasi.Africa. I mean, hey, pharmacy. So, like, I like the spelling. It's like you're saying pharmacy, but it's spelled pharmacy. Like,
exactly. Easy to pronounce.
Very.
So they don't have to do pharmacy. Like, I'm going to the pharmacy. Sounds.
You get. I see your logic on point.
Right.
So, yes, and she's Adeola Ayoola. And again, welcome. Lovely to have you on today's show. So just relax. I'm not interviewing you. We're literally going to be having a question and oh God, I said I'm not interviewing. I said we're going to be having a question.
Don't worry.
We're going to be having a conversation, around health, really, and what you've been able to do, how you've been able to make, your own impact in the space. So we're going to start quickly by, I'm going to ask you a question, of course, but first, just to know you. But I want to say that, I was in my house one day and somebody just came, one of my family friends, and she was gushing about the service that she received, with you guys. So I'll say well done, great work being done.
Thank you.
So what inspired you to start Famasi, and how did you know that you were choosing the right person as a co-founder?
Interesting. Okay. So it was a series of events that led to the whole thing.
Mm-hmm.
I had my internship at National Hospital, Abuja. And, there is the primary health center, state hospital, federal hospital. Then you have National Hospital. Mm-hmm. There's just one. And as expected, it was always crowded. There were a lot of people that used to come there for their medications. I was opportune. I like to use the word opportune. I was opportune to work in the special treatment clinic that catered for people with HIV and AIDS.
Interesting.
And tuberculosis.
Okay.
Yeah. So, it was normal practice to see a lot of people come every day for their meds. Mm-hmm. And then they have to queue. They have to come every 2 months just to refill. And the queue is as long as 100 people, even when they get there at 7 a.m.
Interesting.
So they spend almost all day just trying to get their meds. And it was a routine thing.
I'm sorry, if I were in that situation, I'm done with the meds.
Do you understand? And they need to take their meds to continue to remain healthy. So it was just a lot of stress. I had the idea then, but I didn't know what it was because I was just fresh from school. All I knew was pharmacy. Like, not pharmacy now, pharmacy. But I knew that it was a problem and there probably was going to be a solution, but I didn't know what it was then. Then, sometime during COVID, mm-hmm. I called my partner, who's also my co-founder.
When you say partner, please, can you give us more explanation? Because I don't call your partner who's also your I need.
So not work partner,
life partner. So literally, pharmacy is a family business. You are just following the F's and the F's.
Yeah. So, I called him randomly and I said, is there a way we can put tech in health? But I only know pharmacy. So, is there a way to put tech in pharmacy? I had no idea.
So, random, is your partner a tech person?
Yeah, he is.
Okay, awesome.
He's been a tech person. So, it was just, I had other businesses running and I was just looking for a way to put tech in everything because it looked like everything was going the tech way. And then he said, oh, that's true. We can do something like that. Let's talk about it. Let's think about it. We started thinking about it. Coincidentally, he had to go to the hospital for 3 months after then. Then he also saw firsthand what was happening. A long queue every day just for people to refill their meds. It didn't seem like it was a time, worthy experience. And then he came back to say, oh, that thing you were talking about, I have this idea and that. And then we started to research and
Famasi was born. Interesting. Oh my God, such a beautiful story. I'm looking for my own love tech partner. Now we'll come and make billions together. I'm just teasing. So yeah, I kind of can, no, I can relate to that. And with the way the world is going, nobody wants to queue. I hate going to banks. Like, I just want to do it on my phone because it's just stressful. So I feel like we literally should have, same impact in healthcare, and I'm glad that you are doing it. So one thing I'm also going to ask is, there's this referring theme where some people have referred to pharmacies as the real primary healthcare facilities in Nigeria, because I'm sorry, if I have a headache, I'm not going to be calling my doctor firsthand. Some of us, which is not right, but then we just walk down to a pharmacy to get care. So how do you think we got to the point where most people need to talk to their pharmacists first before doctors? Because it's not right, but how did we get here?
So when I thought about it randomly, I thought the answer to this was because there's a pharmacy in every 200 square meter. But I mean, after talking about it, I realized that that's just like a symptom. The main problem is people don't want to pay for healthcare. Healthcare is expensive. People don't want to pay. It's like you have to go to a hospital. One, you have to queue. Then you have to get a card if you're a new person. And then you have to pay consultation fee. Then queue again to see a doctor, and all of that long process.
And I know they still end up getting the drugs.
Do you understand? But if you go to a pharmacy now, it is really close to you. If you walk down the street, you would see like 3 pharmacies before you get to like a 1 kilometer. So everywhere there's a pharmacy, and you don't have to pay consultation. Even if you meet someone there, the queue is not long, it's not unbearable, and you're talking to someone immediately.
So I think
it's that convenience and access.
Exactly.
That's why people just, walk to the pharmacy.
So if we improve healthcare in such a way that from anywhere I am, like convenience and access is just, and what I need at a point, then everybody is going to be fine, and
it's affordable.
Exactly.
Yeah, because the cost is very important too.
So we won't be having people just jump off to
But I mean, it makes sense, because the ideal thing is when you now go to a community pharmacy who is equipped to take care of the first aid things, and they cannot handle it, then they refer you to a doctor, or a hospital.
Makes sense. Yeah. And now another very funny question is, when you think about care provision, how do you think about it, and how would you say it differs from how doctors think about it?
As a pharmacist, when you come to me, I'm thinking, oh, these are your complaints and these are the medicines that will make you feel better. So I'm thinking problem and solution immediately.
Yeah.
But a doctor will think, okay, this is a problem, but what's the cause of this problem? Before they start to think of a solution. Do you understand? I mean, we are all trying to get the solution, but one is a longer route. And obviously, someone who's sick would... Do you understand? They want quick relief. They want to just feel better immediately. So while the doctor will have to start doing run diagnostics, do all of those tests before they come to why you're having that problem, you're already fine with drugs that someone would recommend to you, a pharmacist would recommend to you. I mean, I'm not saying going to find all of the solution is better. I'm just saying one is faster. And as a pharmacist, you're just thinking solution immediately.
Yeah.
Not all of those diagnoses, except when it's like totally important and you don't want to guess.
So the thing is, I think at pharmacy, the case is a little different though, because you are trying to provide solution, but at the same time, you're allowing technology really guide you.
Oh, yeah.
So even though, this person has this problem, you're trying to find a solution, it's not, okay, I think you should do this. You guys go through, proper checks to ensure that they have what they need. And I'll just say that, can you just build up on this with how, you are stopping the self-medication error, because everybody's self-medicating. And also, aside from how you are stopping that or bridging that gap, how we are also improving people's love for drugs. I know it's a weird thing to say.
I mean, you just said improving love for drugs.
Because that's the only way to get well now.
Well, no. I think what we like to say it as is we are building a better relationship with their drugs. Yeah. So when there is a smoother relationship, it's not like anybody really likes to use drugs, medicines. But if it is better, if it is smoother, if you know that you need to take it to get well, and then it's an easier process, then it's better. So on the aspect of self-medication, I think it is more of, why are people self-medicating? We want to totally stop self-medication at all costs. Everybody's trying to stop self-medication.
Yeah.
But we're not trying to understand why they are self-medicating. Now, it still goes back to that thing I said about access and cost. Exactly. So if we understand from the roots why they are self-medicating, then maybe we can relate and try to provide solutions that will help them. But on our part, what we do is we try to leverage partnerships. Okay. So at pharmacy is not a regular online pharmacy where you just come to say, oh, I need paracetamol, and we get it across to you immediately. Not like that. It's not a marketplace just to buy any drug for now. I mean, what we do is, okay, we have to put a call through. And that's why, you mentioned that personal experience thing. We try to make it as personalized as possible. We put a call through to understand what you need. If we cannot say, maybe some people that need prescription medicines, then we refer to some doctors that we have partnerships with to better understand. And then, that gap where they have to just continue to self-medicate till they get help is breached, sort of. Yeah. So that's how we do it.
So in essence, what I get from you is that you are using, or let me just say that digital technology can change the landscape, in this pharmacy practice, because you guys are able to increase people's adherence to drugs, provide better quality of care, and also improve the relationships that already exist between, let's say, a provider and a patient, for example.
Typically, yeah, that's how we do. I mean, in different forms for different people. A lot of people are already in that space, and we're there too. Helium Health is there too. And so from different angles, everybody's trying to put in that technology solution into health. Yeah. So we're trying to improve their adherence, use technology to constantly remind them that they need to take their pills, and then constantly follow up to make sure they don't run out of the medicines before they need it.
Exactly.
Because, it is when there is an emergency. Looking at our client, Nigeria is a very delicate place. You don't want to have to start running to look for your drugs in a nearby pharmacy when you need it, because they might not even have it.
You'll be on your
and
own.
What happens? Do you understand? So we're trying to monitor when they need a refill, if there is a need for maybe change in their prescription.
Yeah.
Then we talk to our partners that already do that in their space. There's a lot of telemedicine going on these days, and so we leverage such partnerships to just make it all better, make the experience worthwhile and less stressful. It's already stressful that you have to take drugs every day.
So exactly. So let's make you love the experience.
Exactly.
So
a little, let it be better. Let it not be so.
Let's not be so like
cruel,
it sounds like you just really hate that you want to stop. So having you today has been super amazing. I'm excited about what we've discussed, and I'm really, I'm happy to see that the healthcare space is starting to change or write a new story. Because years back, I never saw a dream of health in Nigeria getting to a point where I'll walk into a clinic and then the person is like, what's your name? And then they are typing on their laptop. The day I went to the hospital and that happened, I was like, hey, you don't mean it.
Old big files. And
do
then
not
have
be
to look
working
for your card.
What's it? No, this will happen to me in Babcock. What's your number? And as in, I'm there, I'm literally having really bad pains. Exactly. And then you have to be waiting. They say, we not see it though. What? Exactly. Are you sure? Can you check that other store? I'm just like, God, when is this going to end? So I'm so happy because we have a lot of people coming up in as you said, Helium, we're one of the big players here, ensuring that patients, providers, they are having a better relationship amongst themselves. We're improving that quality of care that's being provided, and also making sure that we have data so that can guide our decisions. So I'm super I'm super excited. Your baton almost played with here, but back to sender. But yeah, I'm really, really happy. And I'll just say that what's the future looking like for you? Pharmacy, pharmacist. Yeah, what's it looking like for you? I mean, we're already wrapping this up.
Cliche answer is bright. But that's actually what it is. It really is bright. I mean, it's interesting to see a lot of people like what we do, and not just like what we do, but support it and try to pitch in their own. That means everyone is forward thinking now. Everybody's trying to find a solution to this. And beyond pharmacy, pharmacists are also trying to evolve and find new ways to do things. So, I mean, I feel if we can all pitch in these ideas we have,
Go together, collaborate.
exactly, eventually, I mean, now the system is broken, but eventually we probably can fix the system.
We have to.
Exactly. And I mean, good health will be accessible, affordable for majority of the population.
We
90%
have to
at
fix
least.
it.
Yeah, so
We have to fix it.
that's what we see right now for the future.
Yeah, I see the same thing. I'm even optimistic. Like I'm like pumped for what the future holds. So
will be
again, thank you for joining us here today, and I'm so grateful to everyone listening to this podcast as well. I mean, you can see that healthcare is changing, and what we just need from you is your support. We need be aware about these things. Make sure people in your community or your networks are also aware. So share this podcast too. And yeah, we'll keep growing as a community, and our healthcare system will definitely get better. So yes. So see you on the next episode. Bye. Thank you.